Great. So, hello everyone. We're going to give it about 30 seconds to let folks trickle in. And welcome everyone. See Zeev and Yoni, if you could let us know that you could see us and hear us in the chat, please. Great. Amazing. Okay. Well, hello everyone. Liat here from Hyro. I'm thrilled to be your session host for today. Thanks for joining. If you have any questions or comments, feel free to use the chat, which I'll be moderating. And our speaker and very close friend today is Dr. Zafar Chaudhry, Senior Vice President, Chief Digital and Information Officer from Seattle Children's. Hey, Dr. Zafar, are you with us?
Yes, I'm with you. Thanks for having me. A
Thank
pleasure to
you.
join. Good afternoon, everyone.
Thanks for joining. And Dr. Zafar will take us through his expertise on how Seattle Children's found the key to a more connected and patient-centered healthcare system. So Zafar, the stage is yours.
Thank you so much. Well, we'll attempt to give you what our keys are. They might not be the same keys that fit for you, but we'll certainly go through that. So thanks for having me. Yes, I'm over at Seattle Children's. And for those folks in the audience who don't know who Seattle Children's is, it's quite obvious we're a pediatric health system based out of Seattle. We serve the kids of the Pacific Northwest, which is Washington, Alaska, Montana, and Idaho. And our health system spans 47 sites across those 4 states. So we see a lot of kids. We also have a research institute, which is in the top 5 for pediatric research and number 1 for infectious disease. So a lot of activity over at Seattle Children's, and we've been around for 117 years. Within that space, we have had, there's about 500 people in the IT division that I lead. And within that space, there are about 12 individuals who are in the digital patient access, care and engagement team, which is our digital health team. And what I'm going to talk about today is sort of our journey in the digital front door space. And this journey started for us about 2019. It was a wet and windy day, and I remember being in the office and got a knock on my door from my assistant who said that there's someone here to see you, and that person is a parent of a patient and would like to meet the person who leads the technology space at Seattle Children's. And I'm like, this is interesting. I'm like, yeah, sure, let's have a conversation. And a parent walks in, but she doesn't walk in by herself. She wheeled in a cart that was loaded with patient records of her child. So she wheeled in this car, and then she goes back out and she wheels in a second car. And she comes in, I shake her hand, she sits down, we start chatting. And she says, I really need to speak to you. And I brought some evidence with me. So it turned out that her child, they had moved from California to Washington. Her child needed a heart transplant, and that was going to happen at Seattle Children's, and her post-care was going to happen at Seattle Children's. And what she had wheeled in were all the medical records that she said she had to bring in to every patient encounter at Seattle Children's, because our electronic medical record was not fit for purpose. We didn't have any apps. We didn't have a patient portal that was of real value. And what she was trying to explain to me was how difficult her life was in trying to get care for her child whilst navigating the mountains of paper that she had just brought into my office. And I have to say that that was a very eye-opening moment for me in terms of, what do people face in our health systems today? And it still exists. The mountains of paper, the inefficiency, the lack of interoperability. And it was at that moment in time I decided that whatever digital strategy we would have at Seattle Children's, we would base that digital strategy and drive it by using parents, caregivers, and patients to help us build that strategy. So that was, having learned that lesson from that parent, we quickly spun up a patient advisory group. And for the multitude of years now, which meets every month, it is the parents, caregivers, and patients that advise me on what digital initiatives, tools, applications, etc., need to be built in our organization. It shouldn't be what I think, it should be what my customer needs. And that's what we've been doing since 2019. We've been working on that. And as part of that, we had, over the pandemic, we replaced our electronic medical record with a new one, Epic, and we launched MyChart as an initiative, as many hospitals do that use the Epic EMR platform. But at the same time, we wanted to build a front door application for our organization, and that was built because the group that we had formed, the patient advisory group, said to us, we really need a tool, a single version of the truth that gets us into all information related to Seattle Children's, not only access to the patient record, but simple things like, how do I get information about where to park, and how do I get information and what the menu is at the cafeteria. So what we did is we built an application in my digital health team. The application's built in-house by 3 developers. These developers built, within that there was programming, there was a UI, UX developer, and they sat down with a group of advisory parents. And it's probably great to be in Seattle because we are surrounded by parents who actually work in technology, and that's really great. And what I'll tell you, in my career history, and I'm an internist physician who defected to the dark side to be a CIO, and I've been in healthcare IT now for 38 years. What I can tell you is that the average 11-year-old has a lot more technology knowledge than I do. And that's very eye-opening of what people need today versus what I think they may need based on my skill sets and based on my age. I'm of the generation of green screens and styluses that you used on Palm Pilots, so I'm pretty old in this space. And so here is a view of the UI that we have within our children's application space. And our motto around it was, we would give you access to care through this single application. So we worked on this application in-house. Some more screenshots of the application. It's available in the Apple App Store and Google Play. And we launched it in September of 2020. We've been tracking the downloads of the application. We've had over 32,000 downloads from the various app stores. We're averaging about 1,000 unique users per day using it. We launched it in English and Spanish because that is what our parents and caregivers asked us to do. The only login for this application, once again in collaboration with our stakeholders, was for the MyChart application. As I said, we have only a custom development team in-house. We wanted to build it on an open platform, right? So we didn't want to get into proprietary tools so that the code would be easily reusable. We have a product manager on this, some developers, and as I said, a UI designer. It's very important to get your user interface friendly, easy to use. Lots of family engagement, as I said. Of course, we also engaged our clinical staff, our doctors, nurses, allied health professionals in this space. And the way in which we engaged them was through a level of interviews, workshops. As we built out the UI, our patient advisory group was instrumental in testing the UI for us and also making sure that it actually worked, because who better to test an application than the people that are going to use the application? So we did lots of prototyping, testing, feedback. There's a lot of communication that goes into these things, but also a lot of stakeholder engagement. And as I said, the patient advisory group was part of this engagement. We use standard tools, APIs, and this digital front door application that we've built, yes, it fully integrates into MyChart from Epic. It fully integrates into Zoom. We use Zoom as our telehealth platform, and people do consume telehealth visits through the app. We use Tromba as an activity calendar that's built into this tool. And the other thing that people asked for was wayfinding. So interesting enough, hospitals are quite complex places, and finding rooms on different floors to attend appointments or physical therapy sessions or activity sessions isn't that easy. Even if you work for the health system, I work for the health system. I've been at Seattle Children's for 6 years, and even I don't necessarily know where all the rooms and locations are. So having a wayfinding application was another request we received from the advisory group, patient advisory group. And we built that by integrating Bluetooth beacons from Aruba Meridian into our entire main campus. So the way the application works is it connects to those Bluetooth beacons. Those Bluetooth beacons have location, where the person is, and you can actually wayfind yourself through the organization. So all those tools were built based on requests. Now the goal here is you have easy access to care and information. As you can see, multiple screens, multiple UIs. One of the really interesting things that was asked for us to build within the app was the ability to track the patient whilst having surgery. So one thing that came out from the advisory group was, when my child has surgery, I go to the waiting area in the surgical suite and I sit there for hours on end, not knowing when the surgery is going to finish, not knowing when my child went into surgery, is in recovery, is in a holding pattern, etc. And the problem is, I'm sitting there for hours. I won't go to the cafeteria to get a sandwich, haven't eaten all day, have other kids with me, etc. But I won't leave the surgical waiting room because I'm so worried about what's happening with my child. Makes total sense to any person looking at logic. So what we also built here is a surgery tracking component within the app. So what we do is we give patients now whose child is having surgery at Seattle Children's a code, a secret code. You give a code, it's a tracking code. And then what they do is they open up their app, they put in the tracking code, and they're able to see at what point in the surgical journey that patient is at. So that way you know if your child has gone into anesthesia, if your child has gone into the actual surgery, if your child is in post-op recovery, if your child has actually been released back to the unit or ward. And that has been hugely successful for us because it allows people to have some flexibility to leave the surgical waiting room. So as you can see, every application we've built into this is what makes sense for the patient. The other piece of this was information. So people wanted to know where they can get food. Cafeterias are important in healthcare. People have to eat and nourish themselves and replenish their energy. So we built in information around the cafeteria, what was on the menu, the usual stuff that you would do around that. And some more screenshots. You can schedule a visit. You can see what activities are happening whilst you're in the hospital. You can also do a new thing, which we've just added to the application. Same principle due to requests from parents, is we've now spun up a virtual urgent care for kids. So you don't necessarily have to come in to urgent care. You can make an appointment for urgent care and you can do a video visit for that urgent care. And we'll only ask you to come in to the facility if it is really that needed. So that's really important. And we have built that piece as well. Wayfinding, I've described already. As you can see, comments from some of our patients. You have no idea how much I could have used this. I've been to Seattle Children's a million times, but I still get lost and I agree with that patient, I also get lost. So as you can see, with the integration with Aruba Meridian, we have the ability to navigate the building and pretty much get you to where you need to be across that main campus. Other information on the go, I think I've described that. Another piece that was important for parents was financial assistance. So Seattle Children's is a not-for-profit facility. If you are struggling to pay your bill, we do provide financial assistance to help people cover those costs. 53% of the patients at Seattle Children's are on Medicaid, and that's a government program. The other thing that we learned in this journey of building an app and working with the patient advisory group was that there are many patients who don't necessarily have, well, their parents and caregivers don't necessarily have access to the internet or high-speed internet. Interestingly enough, Washington split between Western Washington, Eastern Washington. Eastern Washington is more rural. It's more farming communities. Their internet access isn't as great. The other thing we learned from our parents was that not all of them have the latest version of smartphone, and not everyone has Apple. Some people have prepay Android type phones, which are usually a couple of versions behind. So that was another thing we learned. And so as part of our vision to build equity and access in our health system, we will loan parents a device whilst they're at our facility. And they can then use that device to consume the application, use the wayfinding. We even loan out laptops for people to consume telehealth visits remotely, because we thought it was important to be able to give that access. Where we have struggled with the program is we obviously don't have enough equipment to give out to people. The good news is that the equipment does come back once patients and parents have finished with using that equipment. And what we're really doing is recycling some of our older hardware that we probably would have deprecated, but actually recycled into reprovisioning that for use by our parents and caregivers and patients. So that's been hugely successful. And also, whilst you're on our main campus, you can access this application if you're an inpatient through the iPad at the bedside that's provided to all of the beds here at Seattle Children's. So not only are we thinking about the technology, we've been thinking about people engagement, we've been thinking about access, technology challenges as part of this process. These are all really important things to think about. If you haven't done a program like this and you plan to do that, always remember, and it's pretty much the old saying in technology, that it's people first, then process, then technology. You can have the coolest app, but if people can't download it because they're running 5 versions of Android that's behind the standard, then the app won't work because of security issues, etc., etc. So you've got to ask those questions when launching apps in healthcare in general. And then what we've also done is we've fully integrated our app into the MyChart sign-in seamless process. We've made it easier to log in because people have asked us that logging in needs to be a seamless process. And we've enabled that to happen with the integration into MyChart. You can sign in with a username and password, your face, your fingerprint, or passcode is available, whatever the person prefers. The other thing we've done is we've done seamless access into Zoom for our telehealth visits. So you don't have to download Zoom to consume that video visit on your phone. It's all built into the application, and then you make the selections, as you can see on the screen, whether you want to use a passcode or you want to use your Face ID. That's also been very well received, and that, once again, was done in collaboration with stakeholder engagement. All right, and then that's some screenshots of how we've integrated the Zoom and MyChart SDK integrations. lots of positive feedback from our parents moving forwards in that space. So, I would like to sort of wrap this up by saying it's been a journey for us. It evolved from a single parent telling me how they felt and what they needed, to having a single application into our digital environment, to building it from a UI perspective in collaboration with our patients, parents, caregivers, to standing up a team internally to build this using standard tools. All the credit for this goes to my team that have done all the work, that have done all the integration, and also thank you to the clinical staff that have also been involved in validating this application. We went live with a new EMR to get to this place. We also allow access to open notes, which I didn't mention as part of this. So all parents and caregivers have access to open notes, as well as the EMR notes within MyChart. And it changes views based on whether you are on-site or off-site. That's the next step we want to make happen. We want to integrate from your door all the way into our facilities. There are more features that parents have asked for in the wayfinding component that we are looking into building and developing. Right now, you can use wayfinding within the facility. Once you're in the facility, we actually want to expand that further from your house all the way to the facility potentially. And the other interesting ask that has been asked, which makes sense to me, is why not integrate the interpretation? So we have parents from different backgrounds, patients from different backgrounds in terms of their primary language: English, Spanish, Somali, Ukrainian. Multiple languages are serviced here at Children's through interpreter services. And the parents have asked, so why not integrate that into the app as well, so that you can seek an interpreter through the app when you need it to help you navigate the journey moving forwards. And I think that that's a really great idea. So the question would be, once we built the app, had the sign-off from our advisory group, how did we actually publicize it? Because it's great to have an app that nobody knows about. So we did a big campaign just before launch where we put up a lot of posters in our facilities. There's an example of the poster. As you can see, the poster has QR codes that people can scan for Apple versus Android. We have this information now on our website as well, where you can download from. We changed some of the screens in patient waiting areas to publicize the launch of the app, the ability of having the app. We added appointment reminders in multiple languages. So when people were coming to outpatients for their appointments, just like any other health facility, we remind them of their appointment, and we actually remind them of their appointment in multiple languages. We added reminders there as well to say, not only can you come in for your appointment, but please download the application. It's going to be really useful for you. And we also have a support line. So parents can call our support line to get assistance with tools like MyChart and the digital application, which is heavily used by our parents and caregivers. Within the inpatient rooms, we also put guides within that space. We put an orientation with our welcome teams. The iPads that are in inpatient rooms had information on them about the app is being launched, it's coming. Our marketing and communications team partnered with us to help us build these communication pieces. They also helped us do a social media campaign to get people to download the application. Of course, You would also publicize this in places that people go to in the facility most often, and that is the cafeteria. Everybody uses the cafeteria, whether it's employees or it's patients, parents, caregivers. So we did a lot of publicity in the cafeteria space, and all the elevators had signage as well. So multiple ways of advertising the launch of the tool. The information remains to date, so you know this is available for you for those patients that are new to Seattle Children's and want to consume the app. So technology is only one component of our journey in our digital front door space. And I think when I sort of self-reflect on this, we've really only scratched the surface of what people need in the digital space. We'll continue to iterate. And this is sort of the program is run through sort of an agile methodology. We, as I said, we huddle with the advisory group. They give us ideas. We cost out those ideas based on budget we have available. We then add pieces to this application. So it's an ever-evolving thing. And what I find really interesting is when you do initiatives like Digital Front Door, the old model of you get some capital, you build something, and you have a product seems to be dead, right? The reality is when people ask me, when my board members ask me, well, Zafar, when will this Digital Front Door project actually end? I'm like, oh, it's a never-ending project, because we will always add more functionality. We will continue to iterate. Sadly, we'll continue to spend money. Nobody likes to hear that, but we will continue to invest to improve the application. So it really is a never-ending piece of work. And it should get better with feedback, iteration, improvement, upgrades, new features in the module. So the people process piece will never go away in this project. We'll continue to engage and add more pieces to it and continue to invest. The technology itself, it's built on standards. It's not something we actually went to the market and bought an application for. We just hired the right people. Somewhat easier to do in Seattle to build this app for us, and they work for us in-house. And we've not done anything that's not standards based so that we can integrate in the future any new pieces we add. We may not build it all. We may integrate pieces like we did our wayfinding, but it integrates because the APIs used in the tool are standard and work well for us moving forwards. So that is a summary of Seattle Children's initial journey in this space. It took us through a pandemic. It took us to post-pandemic. Here we are, literally 3 years post EMR implementation. And I think we've only just scratched the surface. It's exciting work to do, working in technology. Nobody really cares about the infrastructure that you build. They only care that the tools you build work, they're useful, they provide the right level of information, they're built with huge stakeholder engagement. And then what happens is when you go back to the same people that guided you, advised you to build these tools, and you survey them and you say, well, how satisfied are you with the tool? We tend to get good ratings on the satisfaction because it was never an IT-led initiative. In this particular case, building a digital front door application, in my opinion, has to be led by the person you are serving, i.e., I like to call them customers, but the reality is it's the patients, parents, caregivers. And if you're an adult-based health system, you've probably done this driven by your patient population, which are the adults that you serve, and their caregivers, as well as your clinicians. So thank you so much for joining me and spending some time with me to hear about Seattle Children's journey. We have a few minutes here. I'd be happy to take questions. I think there are a couple of questions here I see in the chat. And the first question is, some years back, Seattle Children's had medical records coming in from outside and only 50% of the kids admitted. house it now. So we are using the Community Connect model. We can access records from all Epic sites if we are authorized to do so by the patient and caregiver. We're not 100% paperless in receiving medical records because there are still records coming in from practices that use very, very small EMRs. But the bit larger EMR systems are electronic at Children's. So we've reduced that number significantly, but I wouldn't say we're 100% electronic reception of records at this time. Yeah, please ask any questions you have. Happy to answer those. Pop them in the chat. Let's see what we have. A shout out to Rami. I think he said we met a few years ago. Yep, and yeah, we did. We came to visit you in Baton Rouge. And my background, I've been working all over the world. I've been at Children's for 6 years and have worked in the UK health system and others across the world too. So it's nice to see people that I may have met and chatted to or seen before. It's really interesting that healthcare is such a close-knit community and you see the same people pop up. It's really nice to know. Another question here. The US is facing an almost unprecedented youth mental health crisis that was sparked by COVID-19 and seems to be getting worse. How are you grappling with it? So that's 100% true. Of all the states, Washington has some of the highest mental health conditions affecting children, teenagers today. We have a very, very high suicide rate. I can tell you that Seattle Children's pretty much on a daily basis is full with mental and behavioral health cases. We have about 30 beds allocated for that, and we're always overflowing. What we're seeing is COVID drove the crisis to people be feeling isolated. And I think what's really interesting to me is there is a lot of work that needs to be done in the mental behavioral health space, not only for children, but also for adults. The challenge we have in pediatrics is that kids don't vote. And because kids don't vote, they don't get the power that they need to lobby, to get the funds that we need to take care of these important things. If you've ever been affected by having a child who's going through a mental health crisis or a behavioral health crisis, it is heartbreaking. And we try our best. We've hired teams of people. We have a unit for mental health and behavioral issues. It's really difficult to deal with, and our resources are limited. And certainly in Washington, we are right now the only facility that is boarding and taking care of children, our kiddos that have these conditions and need help. They need therapy, medication, whatever is needed. We're trying to provide that, but we are really resource strapped, and it's really hard to grapple with it. So yeah, absolutely. But I'm not going to shy away and say that even adults, I mean, with what's happening in the world today, I see that in my own teams. I have 500 people in IT, and not only are they dealing with doing the mission, and our mission at Children's is hope, care, and cure for kiddos so they can live the most fulfilling lives, but also what they're facing with at home, what they're facing with their own children, what they're facing with what's happening in the nation, what's happening across the world. So mental health, I'm a huge advocate of we should invest more money in this space. We're trying our best at Children's, but yeah, kids are grappling with a lot of these issues. And that's really, really, really heartbreaking to see that that's happening. Any final questions as we wrap up? Okay, here's another one. Are you experiencing any limitations with BLE technology while tracking patients in our facilities? I think that not really. I think there are limitations to the technology, but we were lucky enough to open a new tower, and we were lucky enough to have built a brand new surgical suite of 25 ORs in that new tower. So I guess I had the luxury of designing it so that the technology would serve us well versus trying to retrofit it in older environment. And our older towers are up to 40 years old. So yes, the technology is hugely limiting in older ORs, but because we closed our older ORs and launched a brand new suite of ORs, it's been less limiting for us. But that you have to keep in mind. And if you're one of those facilities that have 50, 60, 70-year-old buildings, it's even harder to get the technology to work and be reliable. So far, and if I had wood, I'd touch it, but so far it's worked well in our new surgical suites for us. All right. Any comments from you, Leah?
Nothing besides that. I always love listening to you. You were on our podcast, and I'll add the link here to your episode as well, which was enlightening. I do have one last question, which is really, it has to do with the panel that we're ending off the day with right after this, which is the next 5 years in healthcare. So trends and forward-looking indicators. Can you give us maybe 1 to 2 projects that you plan to be working on in 2024, or maybe just what other CIOs should keep as top of mind for next year?
So certainly for us, I can tell you, just like any other health system, we are struggling with margins. We're struggling with the cost of delivery versus cost of recovery of compensation. So we're doing a big cost improvement program. I don't think I've met any CIOs in the last few weeks that I know that are friends of mine that don't have a cost improvement program in place, right? So we're all looking to see how we can reduce costs. And the question will be, so how do we do that? And I think more adoption of automation makes sense, right? So investing to save is something to look at. And, I would be amiss if I didn't end by talking about AI, because that's the dream everybody wants. You've got to say it at least 5 times in a presentation. But here we are. And the tools that people are creating, vendors are bringing into the healthcare domain space that can automate, that can help take some of that, what I would call support service burden, off the health system is hugely important to look at. So we're doing the same. We're looking at what tools could we deploy that reallocate resources to what's most important. And obviously in our business, what's most important is clinical care and the patient. So you'll see more use of automation tools. I call them automation tools. It's just, AI has just evolved, right, over time to what it is today. And now, because it has access to even more data than ever before, it's just going to get better. But there is a cost of entry into that space, and there's a cost of change, training, etc. So you'll see that. We see that in our health system. The other thing is replacement. And so first, application rationalization. The future can't be running thousands of applications. I can tell you at Children's, we run 1,163 plus applications, which can't be the future for us. We have to start streamlining some of those. And at the same time, modernizing applications too. So the other big project we're doing for 24 is replacement of our ERP system. That was the next logical thing to change because we've had our existing system for 17 years. So we're moving to a new digital web-based handheld type platform that people want to consume moving forward. That's a big change program. So for us, that's probably our second biggest transformation piece that we've done in the last 5 years or so. EMR was probably our biggest one that we did. So we're going to be focusing on that. At the same time, we're going to be focusing on governance. I do worry about all of the new technologies like AI and how are we going to protect our patients and govern those services better. So having a committee to look at AI, we have built an AI policy, which is going to be ratified next week. I have made AI mandatory for all employees, training. So every year you have to take the AI training module that we partnered with a vendor on. And if you don't pass that module, you have to retake the training module, because I'm hugely worried of the drama, which we call copy and paste. and I'm worried about the hallucinations that could happen. AI is amazing. It's not always right. Doesn't always tell the truth. I found that out myself. So yeah, huge focus on that too, but in a governed way with multiple stakeholders at the table, clinical, non-clinical, to provide advice and guidance on how we work and step through what is inevitably the next big hype, right, that we're working through. And we'll partner, like I said, in levels of automation. It'd be great to build some tools into our digital front door app that can, do things for people in an automated way. So we'll be certainly looking at that. So that's what we're focusing on. The trends that I see talking to colleagues are similar: cost improvement, AI, big data. So the other big project that we've just completed is we've moved our entire analytics platform to Google Cloud. So we will be able to use the Google tools, AI, machine learning, everything else, apply it to our data, make better predictions for our patients. Because we're a research institute, we'll be able to use our data to build the next set of hope and cure for our patients. And that's exciting work for us.
Okay, well, we'll have to get you back to let us know how that went. And with the 60 seconds we have left, I do want to give Tucker his answer. His question is, for your app, are you using the Epic submitted app approach?
Yes.
That was less than 60 seconds. Thank you.
All right.
Great. So unless anyone has any last questions, we'll let you go for a short break, because in 2 minutes from now, we finish Digital Front Door Day with a future thinking panel with 4 folks in the industry that you should be very excited to meet. And at this point, Zafar, I want to thank you so much for everything you do with Hyro at our events, with your wisdom, and we hope to see you soon back again.
Thanks for having me, and thanks everyone for listening in.